Today on the Women's Healthbeat, Dr. Felice sits down with Dr. Ron Primas as they discuss healthy traveling tips for women. That's today on the Women's Healthbeat right here on the ZubiaLive Channel. We'd like to say thank you to our sponsor, Harbor Compounding. Harbor Compounding is a full-service pharmacy that specializes in personalized medicine, specifically in compounded hormone replacement therapies, pediatric medicines, pain therapies, custom thyroid strengths, and dermatological preparations. And for those who have four-legged friends, veterinary formulations. If you'd like to learn more about Harbor Compounding Pharmacy, visit harborcompounding.com. Hello, I'm Shane Schultz, the executive producer of the ZubiaLive Channel. ZubiaLive is your interactive live streaming video community that specializes in health and wellness topics that affect you. You can always find us on our social media at ZubiaLive or our website, ZubiaLive.com. Today, we have another wonderful episode of the Women's Health Beat hosted by Dr. Felice Gersh. Dr. Felice is board certified as both an OBGYN physician and integrative medicine and has helped women worldwide with her efforts and her knowledge. All right, without further ado, please welcome Dr. Felice Gersh.
Hi, I'm Dr. Felice Gersh. Welcome to my show, The Women's Health Beat. I'm thrilled today to have one of my good friends all the way from Manhattan here to join me, Dr. Ron Primas. Welcome, Ron. How are you doing today?
Cold, but thanks for inviting me on here. I'm excited to be on your amazing show.
Equally excited to learn as much as I can from you because you are amazing in so many of your abilities, and one of them is knowing how to deal with travel and all the potential illnesses that can befall people when they travel. And as you know, we have a world that's always in motion, right? People are on planes, trains, automobiles, going, coming every which way. So the first question I have for you is, when people travel and they're going to bring a little travel bag with them for emergencies, what do you suggest they bring?
First thing I do is to tell them to get whatever they feel comfortable with. So I have them go to any local pharmacy and get a shopping cart and walk up and down each aisle and say, hey, you know what, that might come in handy, this may come in handy, just personal preferences first. So, but in general, like Imodium AD is always a good thing, triple antibiotic cream, cortisone cream, an oral antihistamine like Benadryl or Claritin, Bonine, which is Meclizine, which is a dizziness tablet, Band-Aids, gauze, pair of scissors, small scissors, some safety pins, just things that may come in handy that you might need over the counter, maybe cough tablets, because syrup is not convenient to take with you, multi-symptom over the counter cold relievers, just basic stuff that you can get that are non-prescription first.
So one of the things that you mentioned is the methicillin. So I get seasick and I get car sick sometimes. So what do you recommend for people like me? Do you do ginger tablets or some other kind of remedy?
Ginger tablets are good. They make these really cool wristbands that go on the acupoints and on the wrist. And those actually have been found to be really helpful in a lot of clinical studies. But as a backup, the over-the-counter Bonine, Meclizine, or Bonine works really, really effectively.
Well, that would be. What about those the pills that they have, the patches rather, the scopolamine? Have you found any good results with those?
That's prescription only. It's not over the counter, but yeah, it's a good thing to have in your kit, especially if you're taking boat trips. I get seasick a lot myself.
Me too.
I go scuba diving a lot, so the thing is that I'll wear it when I'm out on the boat. I don't get seasick. We've been in really rough situations before with really rough surf, and everybody around me was just tossing their cookies, and I had the patch on, and felt a little bit off, but not as bad certainly as everybody else on the boat. So this scopolamine patch works really well, but the only drawback to that is you get a really dry mouth, dry nasal passages, so you feel thirsty all the time. The other thing is some people, it acts as a mydriatic, meaning it can dilate your pupil, so you have to be careful when you put it on not to touch your eye. Especially there are people who have glaucoma, and you can get open-angle glaucoma with it if you accidentally touch your eye with the scopolamine.
One of the things that I've found helpful, and I don't know if you've tried it at all, it's encapsulated peppermint as far as trying to deal with, say, traveler's diarrhea. I don't know, have you ever tried some encapsulated peppermint?
No, but it sounds like it would be a nice benign way to kind of help people.
What about with traveling with food? Well, there, like we were talking earlier about airports, they can be kind of food deserts, or even like they could give you food poisoning. So what do you do to try to prevent food poisoning when you travel? And what do you do if you should get it?
Well, I mean, before I go, I try to make sure that I'm in good a shape as possible for travel, right? Other thing that's really important, there's a lot of people that have reflux because we live in a society that's very stressful, and a lot of people on proton pump inhibitors actually put themselves at risk of having food poisoning because you don't have that natural acidic barrier in your stomach that would kill off any bacteria that would go in first. So first thing I do when I take a medication history from a patient, I tell the patient to first go and do lifestyle changes while they're on the trip first, and just avoid eating before bedtime and whatever anti-reflux lifestyle changes they can do first. And then also to stop the PPI, proton pump inhibitor like Nexium or Dexilant or whatever they're on, and maybe take something like Zantac, which is not going to eliminate all the acid, but a lot of the acid. And because anybody who's on an antacid is going to put themselves at risk. So that's number one. Number two, there's a good prebiotic called Bimuno, Bimuno, which a lot of people use it, beforehand, during, and then even after the trip. So Bimuno is actually really good to have for travel. And proper precautions like washing your hands before you eat, soap and water, getting Purell, making sure that whatever you have is hot and staying hot for a while, not just microwave, like slow cooked things are best. Telling people not to eat anything raw, so no sushi, no ceviche, no steak tartare, no oysters on the half shell. Avoid questionable water sources. Always drink bottled water. And when you're in a really underdeveloped area, it's best to check the cap of the bottle and make sure that it's not filled with tap water. And also squeeze the bottle to make sure that sometimes people will fill up a bottle with tap water with a hypodermic needle, just to make an extra dollar.
Oh my gosh.
So check the cap, squeeze the bottle, make sure that no water comes out of the side of the bottle. Make sure that it's really an intact bottle of real bottled water. So no ice cubes unless you make it yourself with your own bottled water, no coffee or tea. I'm really strict with a lot of this.
I had spoken to you before I did a trip a few years ago to Mexico, where I knew that you should only drink bottled water, and I asked for bottled water. They gave me a glass that, of course, had ice cubes in it. Right. So I immediately emptied the ice cubes out, but I didn't wipe out the glass. I just emptied the ice cubes, and then I put in the bottled water, but I didn't check, I didn't squeeze it. So I don't know if it could have been filled with a hypodermic needle, but I was really sick for the next 2 days with poisoning from that water, I figured it was from the ice cube remnants.
That was my next point. What I tell people also is to make sure that if you're drinking out of a glass, that the glass is thoroughly dry, or drink out of a paper cup. The other thing is that if you drink, some people drink out of a bottle. Make sure that you wipe the outside of the bottle off with a napkin or a t-shirt when you drink out of it, because even the water droplets on the rim as you're drinking out of it can contaminate you. Also, boiling water doesn't really help, because there are some organisms that insist and become heat stable. Giardia, for example, and certain viruses can survive heat. If you're going to go to a place that you don't have access to bottled water, it's always best to get a handheld pump. You can get it at any sporting goods store or any camping goods store, and make sure that it goes down to 0.2 micron, because any organism that's alive is above 0.2 microns. So it'll filter out bacteria, cysts, viruses, everything. So the military uses that, so it's military grade.
What about iodine drops? I know people have used them in the past.
Iodine is good, but again, it will not kill the encysted organisms, and it does not kill viruses. It will kill anything with a bacterial cell wall, but not with a viral wall. If you have nothing else available to you, then a drop of Clorox and a drop of iodine will at least mitigate a lot of the bacterial issues that you come across. I think the CDC on their website has a really good way of making your own potable water.
Oh, this is so critical. And I'm listening very intently, because next month, as we've talked about before, I'm going to India. I've never been there before, and I don't want to get sick in the worst way. So I'm taking this all down. I'm going to listen to this again later. And of course, I don't know what time zone I'm in. I'm going to be not knowing if I'm coming or going. So what do you recommend, dealing with the time zone changes? I know you deal in your practice with celebrities and successful business people who are traveling all over the world all the time, and they're in and out of all these time zones. So what do you recommend for them, and what do you recommend for me?
So the first thing to do is to try and, on your watch, calculate how many hours change that there's going to be. And for about a week before, try and either go to bed an hour later than that time or an hour earlier than that time, depending on which area you're traveling to. There is a really good herbal product called No Jetlag. It's made in New Zealand, but they sell it all over the world. That's been shown in clinical studies to really work really well. So No Jetlag is something I recommend. Also, when you are getting to the destination, try and stay local to that time zone. So, for example, if you can possibly schedule your travel, always try and schedule it where you arrive during the daytime, so that even if you're really, really beat tired, you try and adjust that time zone really quickly by adapting to that day. If going at night, it can throw things off. So if you're landing during that night period, it's a good idea to bring some sleeping tablets with you and take that when you arrive, if you have to arrive at night, just to put you in sleep mode when you get there, and then try and wake up to their schedule. But the best thing to do prior to that, in order to avoid dysynchronization, is the medical term for jet lag, to avoid that would be, do the no jet lag and try to adjust your time zone either backwards or forwards by an hour a day, starting about a week before you go.
Well, tell me what you think of this. Next week, I'm flying to Dubai. They're exactly 12 hours different. So, our noon is their midnight. So what I was thinking I would do, now the plane gets in at around like 7:30 at night. I thought I would just stay up, and not sleep for like 24 hours and just watch movie after movie on the plane, hang out. And then just try to go to bed at the time that normally people in Dubai would go to bed. Does that sound like a good plan?
Yeah, that's exactly what I would do. Some people cannot do that though. If you can't do that, it's best to, when you get there, just take a sleeping pill when you arrive.
Yeah. Well, since I spent half my life working in the middle of the night as an obstetrician, I'm pretty good at that. That doesn't always bode well for people, spending half their life working at night, as we know. But now it's enabled me to do such things as stay up all night if I need to.
Trial by fire.
All right, exactly. So tell me, like, some of the things, now you see all these, celebrities and all of these business people, and sometimes when they do go on trips, they do get sick. So what are some of the things that happen to them? We mentioned food poisoning. What other kind of ills befall people when they travel? What should people be watching out for?
Food poisoning, upper respiratory infection, urinary tract infection, STDs.
Uh-oh, STDs, huh? Well.
Yeah. When people travel, they let their guard down. Nobody's looking over their shoulder. And I can tell you that married people are just as guilty as single people. You know this as a gynecologist. There's a lot of married people that when they're away and they're by themselves, they let their guard down and stuff happens. They don't think. A lot of time alcohol gets involved, so their judgment's a little bit impaired. So I always prepare men and women when they travel, especially if they're going to drink, to bring condoms and dental dams and that kind of stuff, because they say, "Oh no, not me." But the ones that say not me sometimes are the first ones to run into a problem. But I tell them that they can't get STDs from anal, vaginal, oral. A lot of guys come back, they're like, "Oh man, how did I get herpes?" I'm like, "Well, I didn't do anything with anybody." I'm like, "You did nothing?" "Well, I just got oral sex." I'm like, "Well, did you use a condom?" "No, you didn't get anything from oral sex." And then you try and explain it to them, and a lot of people don't get it. But I warn all my patients before they travel, even if they're married. I had a couple on their honeymoon, went to I think they went to Thailand and Bangkok or wherever they went, and then they both came back with something because they got into a group sex situation on their honeymoon.
Oh my gosh.
So nothing surprises me.
No, I guess in your career you've seen it all as well. In terms of like traveling to exotic locations that may have tropical diseases, how would people find out what kind of vaccines they might do well to get?
Best thing to do is try and find a local physician who's certified in travel medicine. They're usually the people that are credentialed and have studied this and know it like the back of their hand. If you live in a community that does not have a travel physician, then Centers for Disease Control website. So you go on www.cdc.gov/travel. Has a list of different countries that you're going to go to and what the risks are and what the suggested vaccines and preemptive medication should be. Sometimes it goes a little overboard because they have to paint everything with a broad paintbrush. So sometimes they give a little too much information, but that's where the travel medicine specialist comes in to kind of like weed everything out and kind of tailor it exactly to what your needs are. A lot of people have had a lot of vaccines that they don't realize that they've had already. Sometimes my patients, when they don't know what they're immune to, I'll draw their blood if they come in enough time beforehand just to check and see if they have antibodies or things. One thing that is on the uptick now is mumps and measles, actually, and rubella when people are traveling. So a lot of people, even here in the United States, have let their guard down and don't get an MMR vaccine or are not up to date with it, even though it supposedly immunizes you for life when you get it as a child. Some people's immunity wanes a bit. So I also get an MMR titer before they leave, just to make sure, because there was quite a few people that come back with measles, even going to England, for example.
Yeah, I think that's a really important point, because people don't get the natural immunity that they get if they had gotten the disease as a child, like the way it used to be. And I think none of these vaccines really last for a lifetime. So, and getting something like measles may have a low risk of having really adverse problems if you're a child, but as an adult, getting something like measles can be really catastrophic, correct?
Well, you can get pneumonia, you can get encephalitis, there's meningitis, there's a lot of different things you can get as an adult with it.
So when did you become a travel specialist, and what made you decide to go into that field?
Well, it was, about 20-something years ago. So I was director of an AIDS clinic in inner city Brooklyn. And at that time, it was a big immigrant population. And a lot of my HIV patients that were coming in were also coming co-infected with other tropical diseases like malaria, dengue fever, leishmaniasis. So you had to be adept at, learning all this stuff because you're seeing it in real time. The biggest claim to fame I had were those two people that I picked up that actually had bubonic plague.
Oh my gosh.
So that was unusual, but that wasn't a tropical disease. That they acquired that in New Mexico.
Doctors like you are very rare, aren't they? I mean, someone who's so proficient and knowledgeable in travel medicine and these sort of exotic diseases. You're like, one of a very small handful of doctors in the country, I'm sure.
But there's a community of us that are all connected around the world. So that's the other thing I was going to say. In addition to CDC, if someone wants to find a travel medicine provider, International Society for Travel Medicine website, which is istm.org, and then the American Society of Tropical Medicine and Hygiene, which is www.astmh.org. And there are travel clinics on both of those pages. And they also give suggestions on how to prevent getting sick.
For people that are on the East Coast, can you just tell everyone how to find you if they'd like to come to you?
Sure. I'm in New York. You can look me up on my website. It's www.travelmd, like medicaldoctor.com.
That's great, because everybody wants to go somewhere, right?
Exactly. And, not everybody gets sick, going to underdeveloped countries. Just plane travel, for example, puts people at risk. Sometimes if the plane's on the tarmac, like we talked about, for hours and hours and hours on end, and that food is just sitting there, even if it's in a refrigerator. I cannot tell you how many people come back with food poisoning after being on a flight, and for sure they got it from the flight. The one thing that is a myth is people claim to get sick from the recirculated air inside the airplane. That's not true. It actually goes through a HEPA filter. What gets people sick from the air on the airplanes is it's very, very dry, and it dries out your respiratory passages and puts you at risk of having upper respiratory infections. The thing is, it's what your proximity is to an index case of someone who is sick. So if someone is either sitting next to you, flanking you on either side, or directly in front or in back of you and are sick, you have a much higher chance of getting sick from that. But if you're sitting like in an area of the plane where nobody is sick, the chance of you getting sick is actually really low. Another word to the wise is, if you are going to book your seats, make sure that you try and stay away from a bathroom, because they've done studies and found that seats that are proximal to whatever the bathroom is have much higher microbe count.
Oh, that's good to know.
Yeah,
I've also heard that the microbe count in the water containers, where for hot water, that you should avoid getting tea on an airplane as well.
Oh, okay.
Yeah,
I didn't read that.
Bottled water.
I won't have that anymore then.
No hot tea on a plane, right?
I won't
No tea, maybe not even any coffee. Just get the tomato juice, maybe.
That's it. But all that bacteria might be good for my microbiome.
Well, take those probiotics that you just recommended.
Right.
I am so appreciative. I'm going to take advantage of all of your advice for all of my travels coming up. And we will definitely get together again another time and talk more, because travel medicine is only a fraction of what you do. I know you do everything, right? And I'd love to have you come back and talk about how you treat travelers from around the world and your concierge practice and so on. So you think you could come back another time?
I will absolutely come back. Thank you so much for the invite. This was great. And I appreciate you, and you're such a great, amazing, not just OBGYN, but just a great all-around physician. And you know a lot more about other things other than just straightforward OBGYN stuff too.
We both have fun learning, working together to expand our abilities to help all our patients and to inform all the people out there in the world that can access this particular program and future ones. And so thank you so much, Dr. Primas. Thank you for joining me, and have a wonderful rest of the day.
Thanks, you too, and Happy New Year.
What another great show from Dr. Felice. I know you're probably thinking that was a lot of information all at once. Well, that's what's great about ZubiaLive. You can actually check out all the information again and again at the ZubiaLive channel at our website, ZubiaLive.com. And remember, if you have a health and wellness topic or story that affects you and you'd like to share it with the ZubiaLive community, make sure to visit our website and download our live stream app at ZubiaLive.com or your favorite app location. But for now, we'd like to say thank you for watching, and we'll see you again soon. Thanks for joining us today. While we're grateful for our host and guest on ZubiaLive, we must mention that the views and opinions expressed are not necessarily shared by ZubiaLive, its hosts, guests, affiliates, sponsors, management, or employees. Furthermore, ZubiaLive videos are not meant to replace any medical care and should not be used in lieu of seeking professional medical advice. We hope you enjoyed our broadcast, and we'll see you again soon.